Okay, so what we're going to do is you're going to hold the needle with the needle driver kind of in like a half moon crescent toward your right hand.
Yeah.
Okay?
And you want to maneuver the banana or like hold it in your hand so it's comfortable for you. Like it's a good position. So what you want to do is you want to have the needle puncture the wound like near the area like straight on, and then with the flick of the wrist just come out the other side.
Yep. So you're going to rotate it. So rotate your wrist so the needle's coming out the other side. And then with your needle driver.
And the depth that you go depends on the depth of the wound and the severity of the wound too. So we'll come around and help you guys.
So then you're going to pull it through so that you just have a little bit left at the end. Don't leave too much excess because then it will make it really hard to pull through. Okay?
Okay. And now you want to wrap the side of the needle that has the needle around the needle holder twice.
So you're going to hold the end with your needle around your needle driver 2 times.
And you want to grab the other side of the string with the needle holder and pull it through like a knot. I'll come right over.
Okay, so then you grab the excess that you left out with your needle driver, and you're going to kind of pull your hands apart. So you're going to pull
to make a knot.
That end through, kind of goes through the tunnel. Then you have a knot like this. You tighten it. Then at the same spot, you're going to do that 2 to 3 times. So wrap, pull the end through. Then you're going to pull the ends taut and snip the ends. And then for your next one, you just move a little bit down the banana. Okay? So now we're going to walk around and help everybody.
So we have 5 minutes, so we're good.
Yeah. So
yes.
Open. Okay.
Your scissors.
Yeah. So if you're right-handed.
Yeah. These lock. So all you do is just press them out. You're fine.
So you're gonna
Oh, and I can give you one.
Yeah. So kind of hold it like yes, exactly. Like that, and then you put it through. Okay. So everybody put their needle through so that you have a little bit left at the end.
Yes.
Okay. We only have a few minutes, so let's try to get everyone to do one. Okay.
Okay. So we'll hold this.
Okay. So good. Okay. So. Yeah.
Now you can
Okay. So
put
once you have
this
to
needle
go ahead and do your. Oh, I'm
into
so
the
sorry.
needle holder,
I need to do
so
that.
it's like. So
It's
you
kind of
hold
hard
it
to explain
press.
the wrapping. Okay. So once it's pulled through,
There you go.
then you're gonna wrap it. Yeah, so make sure you have a little bit less.
Okay. And now you can do a suture.
Yeah, and then you're gonna hold this with your left hand. Yeah. Good. And then
No.
you're gonna.
You're a fast learner.
And
Well, I
then,
mean, if you count me sewing my hands together.
yeah, and you're gonna wrap it. So take this. Yeah. So hold this with your.
All right. Now you can pull. No, use your needle holder. You don't want to get pulled direct.
Good. And you're gonna grab this with this.
You want to leave a little bit, so you can let go of this now. You'll hold this. So grab this with your
Now
left
pull your
hand.
right hand back and your left hand forward. Perfect. And then you do that again.
And grab the needle holder
Okay,
with your
good.
right.
So now pull it so there's
And then wrap this string around that twice.
good. Okay, now hold this with your left hand. Wrap it twice around. Your needle driver. Yep, so just go like that.
Here. And then now grab
Now
that.
with
That
this,
side of the
grab this.
string with this.
Good. Now pull
And
your right
then
hand
now
back
pull
and
it
your left
through.
hand forward.
And then you would make a knot.
Perfect.
There you go.
Okay, so I mean,
So
there's
do that
excess,
one more
but
time
no,
and
that's
then you
fine.
can cut it off.
Then
Yes.
you do that same thing again, so you start with the wrapping, pull, and then cut it, okay? How you guys doing? Did you get it?
Yeah.
Yeah.
Okay, so you have it through. So you want to pull this not all the way through, just so you can have
Is
it.
skin really this soft when they're
And then
doing it?
with
You know, I'm not
the
sure.
holder, wrap the string around.
Let's test it.
Yeah.
So this is that.
Okay, did you guys get it?
Yes.
I wrapped it twice. Okay.
Two.
Good. So you're
And
right
then
there.
grab
Yeah, pull
that
that side
string
in.
with
You're
it.
gonna wrap it around and give it.
Yeah, I know.
Now grab this string with it. And then now pull it through, just like you're making a knot. Yeah.
Wrap it twice. Good. So now you're gonna
There you go.
take this and grab
So now just do one more and then you can cut it off. So that's a good suture.
I don't have scissors.
You don't have scissors?
Not the clamp
Yeah.
ones.
Okay.
And like last night I was with the Nate and like
Yep.
we had this
Grab
like
the
this
end.
and we can pull through.
Oh,
Grab the end with your
And
needle driver.
you said your
No, it's okay. Yeah, so just get it wrapped.
Because we say these other
Good.
people
Okay.
stuff.
So
Yeah,
you grab
and
it
she knows them, I didn't.
and wrap it around here, you don't hold it like.
Now you're gonna pull your right hand this way.
And then grab it with the street.
I know you're not.
Yeah, kind of.
There's your right hand.
I know. I
Grab
like
the
her
street
around.
With the wrapping. So let go of that. Sorry.
I had to wake up at 6.
And then now pull it through.
Yep.
So you would pull this way and then the string that way.
Okay.
So which way
where's
you
your
go?
good? Yes. Okay. Then pull your right hand this way and your left hand. this way.
You see how that works?
Perfect. Yeah. Thank you.
And then just do that one more
And
time.
there's your knot.
And then you can cut it off.
So then you let this in, and then do the same thing again. So grab, and pull, and then you would cut the ends. Okay.
Are you getting it?
Okay. Do you get it? Yes. Pull.
I don't even know what's
Yeah. It's good. Yes, I'm really used to CSI.
I was like,
I like it.
Do you guys get it?
That's
I don't
good.
have the plan.
You do freshman seminar, you could do honors or
Can I borrow somebody's clampers real quick so we can get everybody?
club math. That's the one I JTA
Yeah.
for. So, but definitely the honors program.
Thank you so much. Okay.
It's in this class.
Yeah,
Yeah, and you get
So you're right-handed, so you're gonna hold it
$1,500
kind of
every
in
year.
this shape
with
towards your left
scholarships.
hand. So go ahead and grab it. This side. So grab it with your right hand.
And you finish with a nice golden cord that says University of
Perfect. Okay, so now you're gonna go through,
I'm from Hungary.
rotate the wrist. Good. All right, now unclamp. Grab that with your other hand. Good.
Did you do
About
it?
like that much at the end.
I like you.
Now
Yeah,
you're gonna
that's
keep
good.
holding that. Grab it a little bit farther down. Good. Okay,
The
now
other
you're gonna wrap
people
it
taking
around.
selfies with their bananas.
Grab that in. Pull your right hand back and your left hand forward. Perfect. There's your first knot. So then you would drop this and then wrap with this again. Yep. So you do like 2 knots at the same place.
So like Julian said before, when somebody comes in, you clean the wound with disinfectant, and then you can add some local anesthetic so you can do the surgery. And you would add like epinephrine
you would cut it,
to
but that's
slow down
okay.
the
Yeah.
blood flow, because the epinephrine is a
Yeah, so like what you
vasoconstrictor. So you don't want to add, you can't add the epinephrine to the toes, nose,
And then you would just
fingers, and the
start
tip of the
over
penis,
once
because you will lose the blood
don't try
supply
to do
and
like
the tissue will
a
die.
matrix.
So only add it to like
So
major.
yeah, it's kind of just like one at each spot. Yeah, so try to do one more.
Well, I just know those questions.
So just be like doing and making a not doing.
Yeah, that's like the basic. Yeah, the basic. Yep, first with the wrist.
You just pull it. Usually you do it.
There you go. Perfect.
You have to do it 2 or 3 times.
And then you can.
Yeah.
It's kind of iffy in there, so make sure you
So because PAs are under physicians,
I saw
so the
it.
physicians just tell the PAs what to
So now
do.
take that
and like,
Yep, pull it out.
depends on what you want.
Good. Yep.
Oh.
Yeah, it's
Okay,
like
good. So then you're gonna wrap it. Yeah, so yeah, take this and you just go like that, okay? Wrap it around
Yeah, a lot of
twice.
people are
1, 2.
opting for
You know,
PA
you're gonna
schools
take
and
this and
medical
you're
schools
gonna grab
just
the
because
ends,
it's
this end
like
here.
less schooling
Yep.
and you
Okay,
kind
now
of
you're
do
gonna pull
the
your
same
right hand
thing,
back and your left hand forward.
but it's like a whole lot of, you don't
Perfect,
need
and
to
there's
do
your
that.
first knot. Okay, so then you would let go of this,
Medical school, you come
and then
out
you
with
would do
like
the wrapping again.
for like $250,000.
Yep.
This is crazy, but
Perfect.
oh well.
Yep, and then you would take your excess end,
It's worth it.
grab this.
So I think we have 2 more minutes, so you guys could do a suture too.
So go ahead and, yeah.
Or do you guys have
So
any
grab
questions
this
for
end now.
me about pre-med or like for pre-dental for the other?
Grab it with this.
No? Or how college is like? Are you?
Right hand back.
Is this better?
Good. So that's your
It's so
second
much
knot.
better than high school. I hated high school.
Okay.
So it depends on your schedule. Some people in medicine, pre-med are like not as busy as me. I'm kind of more on the extreme side. So I'm like kind of, nobody does what I do.
Well, even though he's extreme, even your average pre-med, you're going to be really busy. Classes are hard, you know, but it's fun because, you know, I always think you have to just keep the keep the goal in mind. You know, when you're bogged down in that organic chemistry, you know, just think about, I'm going to be a doctor someday. So it's just kind of important to think about. So it's hard, but it's definitely doable, and you just have to really want it. Yeah.
It's just how much effort you want to put into
Oh, yeah.
it. Like in high school, like I didn't try as hard, you know, and I didn't really care about school. And I came to college, and it's kind of a good place where you can just start over and just really concentrate on your work, and then I did amazing. So if you guys come to UCCS, definitely sign up for the freshman seminar class, Club Med, or the honors program, which is both two good programs, and then we'll be teaching that. I teach general chemistry laboratories, so you guys, if you sign up for Gen Chem, then you probably might have me for laboratory.
And then if you take Club Med, we'll be your teaching assistants, and Dr. Schober is one of the teachers. So if you ever come to UCCS, definitely do that. Yeah.
And I'm always in the science center,
Yeah,
so
me too.
you guys could always say hi.
Yeah.
No, I don't play sports. Yeah.
If you're serious, I mean, you don't have time, ultimately. So I think there's a couple people who do like track, but it's not the norm. So most people are just, you know, working, volunteering and shadowing doctors and stuff like that. So, but it's fun. If you have a passion for the medical field and healthcare, you'll be great. So, did everyone get a couple of sutures done? Awesome. Okay, so hopefully that was just a good basic intro for you guys, and you'll definitely use it later on. And now it's just you always want to throw your needles in like a sharps container, so not in a regular pack or anything. Okay, so needles in here, gloves in there, and you guys did great. Good work. Yeah.